ready?
It's live.
Oh, okay. So, hi everybody once again. This is Dr. ELAHI, and today I'm also, doing one more BeautiFill laser liposuction procedure on this lovely lady. This is actually her second time. The first time she had the abdomen and the flanks fat removed, and she had it transferred to her breast. Today we did her abdomen again because she had a little bit more. She wanted to remove her arm. We did her arms, and now we're going to transfer the fat to her face. So as you can see, this is our BeautiFill machine, which is assisted by laser. And so whenever we are suctioning fat, the laser assists in gently removing the fat. And the fat gets harvested in this canister, and this is sterile. And this harvested fat is free of any blood, debris, fibers. It's just pure fat. You see this? Pure fat, gold. And so this fat has been removed from the areas that she didn't want the fat in, and we are replacing it in areas where she actually wants some volume replacement. So the breasts were done and she had good results, and now we're going to do her face. As you can see on her face, she has some volume loss. She's somebody who does not like to do the hyaluronic acid fillers. So fat will be a very natural way to enhance and rejuvenate and replace volume on her face. Fat, you can also call this a natural filler, natural way to rejuvenate and restore volume. So what we're going to do now is we're going to start injecting. I have some areas that I have marked already. She's already numb, she's comfortable, and we're going to start injecting in those areas. She has temple regression right here, jawline needs help. She has sagging right here. We can give her a little lift, and then her under eyes, we will do that as well. She's all clean and numb, and now I'm going to go ahead and start transferring the fat, which has already been harvested. So this machine really lets me do everything. We can numb the infiltration process with the same machine. We can harvest the fat through the same process, and then we can inject. So it's really a very amazing system. It's a closed loop system where the patient can get everything done in one sitting and be very comfortable. So let's go ahead and start injecting her. So I'm going to start with her temple area. When we fill the temple area, we actually can give a really nice lift to the face, because when we lose, normally we have fat pockets that are sitting under our skin. They become really thin, and they also start like regressing. So patients start experiencing hollowness. They also start experiencing, can I have some space here? Thanks. So when we replace the fat in those areas, which is a natural way to do it, like you see, she's very comfortable. I'm slowly replacing the fat in these areas. If we do all this with a hyaluronic acid filler, we will be using like 20-30 syringes, which is not very cost friendly. So when we use your own fat, first of all, we know you're not going to react to it. It's a natural filler as well. It's also very economical. So I'm going to continue to fill her temples here for a little bit to make sure we get her a desired volume. Obviously, we're gonna make sure we watch the anatomy and stay away from the danger zones. The now BeautiFill fat has 90+% integrity because of how it's harvested. So there's a 90+ chance that this fat is going to stay, and obviously there's always a little bit of percent that's going to dissolve, but most of it is going to stay, and if it stays with her for 3 months or more, then she'll have it forever. I'm going to move into her cheek area now. And we just kind of do a retrograde. Let's look at the difference on the two sides. See how nice that looks? It's all filled up here. Okay, Lily, can you tell me, please? Okay, that's just, I think it's a little blocked here. We can easily use 25 to 50 cc's in a face for volume replacement, depending upon, you know, how much volume they have lost. And imagine using hyaluronic acid fillers and the cost of that, you know, that's horrendous. Can you keep counting the syringes? How many is it?
That's going to be number 5.
Okay. So that's already 5 cc's of fat, which is, if we use 5 cc's of a regular HLA filler, that's a lot of money. You see how nicely this fat is going in, because this fat was harvested through a very through an amazing technology, the BeautiFill, and so the harvested fat is free of any fibers and all that junk, because all that, if you show them in the canister, all the junk and blood is in that garbage can, and only the fat that's, you're gonna so the fat that's harvested is pure, and that's what is in that canister right there. I'm trying to speak loudly. With the mask it's really hard, but I'm trying. So look at how nice her cheeks are looking now. Wow, they look amazing. Look at that. It's fantastic. Very nice. Okay. Lily, you excited?
Very much.
Okay. And if you notice, she's awake, but very comfortable. Can I have an alcohol? Just a full. Do some in her under eyes. We do the under eyes, the tear trough area, a little bit in the under eye. Obviously, you have to be very careful. Fat is right. Normally, fat resides right under our skin layer. So we know where we are putting it. It's going to be subdermal in the subcutaneous area. That's where we're going to be putting the fat in. And I'm constantly moving to make sure I'm not putting too much in one place, but actually distributing it properly. That's good. We put some in the hollows here. And the good thing about this is when we do put the fat in, we can mold it like right away and push it in the desired areas if you feel like it's a little lumpy or something. So that's very, open your eyes. Okay, nice. How many is this?
That's number 9 in your hand.
9? Okay. So we already have put 8 cc's in her place right now. And obviously it's a process where I have to be very patient and cautious because we're dealing with the face. So it does take a little time. See how I can just mold it? It's really fantastic. Literally just mold it in. That looks so good. Okay. You still have a little ways to go, Lily.
Okay, no problem.
You can go to sleep.
You can already see how much it's lifted.
Yeah. So numbing is the key. Like I do like to keep my patients very comfortable. I will numb them very nicely so that I can, also that's the key for me to do a good procedure. If they're comfortable, then I'm comfortable, and it works both ways. And again, you can see the cannula. I'm still in the subdermal area. You can actually just see me lifting the skin up, and I'm under there in the subcutaneous plane. Trying to give her some contouring here and also replace her fat nicely. Okay. That looks really good. Okay, let's do this area now. She has a lot of sagging in this area and a lot of volume loss, so we're going to work on that now. And I usually try to make one entry point and go through that. I need the benzoin. very sensitive area that we have to be very careful, because there's some arteries here that we need to be careful about. But so I'm right now filling the nasolabial fold. That's a complaint of a lot of ladies, right? Where you get a nasolabial fold that's like really saggy, or there's no volume in there. So that's what I'm doing right now. And I'm constantly moving, so I don't want to, and it's a blunt cannula, so we always hope that we don't puncture a blood vessel. But we keep moving, and that's the way we stay safe. I think the key point also here is look how comfortable she is. But if I wake her up, she'll talk to me. Right, Lily?
Mm-hmm.
Okay. Nice. We're getting there. Okay. See, now I can just mold this. There you go. No more bumps. How many more total?
This one will be 15.
15. So that's 15 cc's.
Yeah.
Okay, let's work on this area. It's also a very good way to enhance chin. Some people have chin regression, just genetics. It's a good way to naturally improve the angle. See how smooth it's all getting now?
I have to go let her son in.
Oh, okay.
That's number 17.
Okay.
Okay. Now we're going to make her jawline, and then you'll see the difference on the two sides. Okay, Lily? All right, so now we're working on the jawline. Jawline is also a very important feature in definition of your face. The V shape is very popular, looks youthful.
This was 19.
So we don't just randomly fill the face, we obviously gonna give her nice contouring, replace volume where she needs volume replaced, not just make it like a big puffy thing, you know, so it has to be done very meticulously according to the anatomy and according to the natural features that the patient has. I need some alcohol. I'm going to show you guys the difference now with the on the two sides, and then you'll get an idea of what it's looking like. Wow, that looks so good. Just can you see the tightness here? Just can you see how nice? She has like a blush line, a jawline, cheeks. This is all lifted right there. The temples. So compare it to this area, to this side. And this is one side done. So this is what fat transfer to face is like, a natural filler. For your face, we can use a lot of cc's of fat, up to 40-50 cc's, which is impossible to do with a filler. But if you have an aging face and you feel like you need a lot of fillers, this is the best way to go. Use your own fat to get that volume replaced. So I hope you all enjoyed the video and our live session. And I love telling you guys about what we do here. So do give us a call if you're interested in our BeautiFill laser liposuction procedure with fat transfer to either your face, hands, buttocks, breasts, wherever you desire to have some volume replaced. But we are here, and we love it. We love doing this. So give us a call. Thank you again for watching.